Hello and welcome to Psyched, the show where we explore psychedelics through social, economic, and political perspectives.
Have Dr. Lee-Anne Francois-Dornbusch. Dr. Lee-Anne is a naturopathic medical doctor with over 26 years of formal education, practicing integrative mind-body, heart-soul therapies, incorporating plant medicines and sacred sexuality. She is a quantum therapist, transformation specialist, and shaman facilitating the return of the divine self. Mother of four, she resides in Chicagoland, Illinois, hosts the podcast Naturopathic Life and Living, and is a columnist for both XBIZ and Sexual Health magazine. Thank you so much for coming on, Lee-Anne, and welcome to Psyched.
There we go. Hi, how are you? All right, I see that you are muted.
We're doing wonderfully well.
Okay,
yes,
perfect.
You're doing great.
Okay, great. Okay, well, I wasn't actually planning on presenting today from a vehicle, but things happened the way that they were, and I'm down in LA with my daughter. So we were just at a protest down here. So, you know, doing it as it is and coming in. So, yeah. So with that being said, I really would rather do something a little bit different. I've really appreciated all of the different speakers that we have, and I think that it's really great that we've had people from so many different fields, meaning we've had doctors, we've had researchers, we've had all different kinds of people. And instead of me talking about myself, I wanted to be able to give an experience for everybody that's listening. So with that, there are a few different things that I want to talk about. One, I appreciate that I'm actually able to talk about cannabis, because a lot of times I've seen in the psychedelic field that people discount cannabis and they say that, oh, no, cannabis isn't, it's not a psychedelic. And I don't agree with that, because people get high, right? So the THC definitely has an aspect that brings us to that higher state, which is, you know, in my opinion, that's what a psychedelic is and what it does, right? It brings us to a higher vibrational frequency that allows us to be able to access aspects of ourself and of the collective that normally we don't resonate with, or, you know, we're too distracted by, or things like that. So I appreciate being able to be on here and talk about cannabis. With that, I wanted to talk about, there's three different things that we have to have or deal with in any kind of a given situation to make a decision about anything that we do. And it happens all the time, but we don't normally think about it. However, when we're working with psychedelics, we definitely have to pay attention to it, and it's part of our treatment protocols. So with this, one is intention, one is the feeling of safety, and the other is consent, right? So we have to know what our intention is, so that way we are being guided on a certain pathway, because that's where we're heading and that's what our focus is. Now, does that mean that's exactly what's going to happen? Well, no, but it's putting our intention to where we want to go, so that way we understand what is supposed to be happening, so that way we have the capability of feeling safe, and then we are capable of being able to give consent. So that's, you know, those are the three things that are there. So what I'm going to do in my time with everybody today is to be able to let you know what my intention is. And so my intention is to be able to bring you all on a trip, on an experience that is uniting with the essence of the plant. And I'm specifically talking about cannabis, so we're going to be working with her today. And that way everybody can feel safe. So with feeling safe, since I'm going to be doing this presentation as like a guided visualization, if you're driving or operating heavy machinery or anything like that, please, I need you to stop doing that, so that way you can partake. And if you can't, then I need you to turn the volume down, so that way you don't hear it, because I need to make sure that you can totally focus on what I'm going to be talking about, so that way you're safe. And then If you decide that, yes, you want to partake in this situation with me, I'm going to be taking you through the ingestion, both like physically. Obviously, I'm not physically giving you any substance right now, but we're going to connect to it spiritually, which is like mental and emotional process, and then guide you through the processing or the digestion of the product, as well as doing like an inhaling, breathing kind of thing that you can connect with your experiences, or just, you know, imagining doing this, and then you know, being able to connect, so that way we can have that experience as we're kind of winding down the last few days of this, to be able to offer that kind of a situation. So if you're willing to do that, now that you heard where I want to go, and you know that everything is going to be good and it's safe, and I know everybody's safe, and then just go ahead and consent, and I can't hear you, but just go ahead and say out loud that, yeah, this is something you want to do, and I'll wait just a little bit, so that way everybody can do that. And it might seem silly, but yeah, go ahead and claim that, use your voice out loud. So all we're really going to be doing is working with our breath, working with our voice, and doing some movements. Okay, so yeah, if you want to do that, we'll get started. Okay, so first of all, if you can just imagine what it looks like to look at a leaf, right, for the cannabis plant. So if she has 5 leaves and then a stem coming out of the bottom, right? So we have the one on top, and then the 2 on the sides, and then 2 lower on the side. So if you can think about that as yourself, right? So the top one is your head, and the 2 top ones off to the side are your arms. And then the 2 on the bottom are your legs. And then the stem coming down is like a tail or a connection from your body straight down to the earth, which is exactly what the plant does, right? So when she's growing and she's attached to the ground, and then she's rooted into the ground. So that's us. So if you can just embody and be that plant leaf, that would be great. And just imagine that stem rooted down into the ground. And so you're connected to Mother Earth and to that ground. And so that's our feminine quality, where she's feminine and she's attached to the earth, right? So then as we're sitting there and we're connected to the ground, and if you can imagine being outside in the beautiful sunlight, and you reach up and you can feel the sunlight on you, and that is attaching, connecting, being connected with the divine masculine, right? Because the sunlight and the ethers in the sky is all of our masculinity. So if you connect your femininity with the ground and the sky, with your sun and the air and the masculine, and you're connected from top all the way to bottom and back up, and you can feel all of that through your body, then we're connected. Okay, now if you can imagine, if you have whatever it is that you like, if it's an edible, like that piece of food, or if it's a concentrate or a tincture or anything that you can just ingest, and if you can imagine going ahead and putting that in your mouth, just go ahead and put that in your mouth and feel it on your tongue, move it around, taste that strong flavor of that rosin, right? That golden, beautiful, distilled, gorgeous oil, thick in your mouth, and taste that into it and swallow it down. And I'm going to talk about how that goes down, and it's going to go down through your esophagus, and everything that it's touching all the way down, it's going to coat, and you're going to feel that almost numbness of it as it goes down, because that plant, that essence, that cannabis is flowing all the way down, and she's touching everything on the way down, and all of your choking up and all of that, I can't say anything, and all of that, I don't know what to do, and all of that, she's touching it and she's grabbing it like she's holding it, like she's holding the hands, and she's going down into your stomach, and your stomach is churning. And if anybody has any kind of fears or anxieties or tensions that are coming through your stomach, she's coating those, and she's grabbing them, and she's saying, I've got you, you can let it go, you can let it go, you don't have to hold that anymore, I've got you, because that's what she does. She disconnects us from our crap, so that way we don't have to deal with it anymore, and we trust her, and we just let her take us. We let her take us to a higher realm, to a higher vibrational frequency, to a better aspect of ourselves, before we had that trauma, before we had that angst, before we had all of that anxiety in our stomach. And then she goes through and she passes even more, and she goes through and she goes past all of those muscles in our gut and goes into our intestines. And then we're mixing with all of our hormones and all of those anxieties again, and fears and all of this craziness. And she says, I've got you, I've got you, I've got you. And we say, thank you, thank you, thank you, because sometimes it's really hard. Sometimes it's really, really, really hard. And she's got us, and we don't have to fight. We don't have to struggle if we just trust her and let her take us. And then it goes through. And what happens when we're in our digestive system, whenever we consume cannabis and it's in our digestive tract because we're eating it, then it goes into our bloodstream, right? So once it goes into our bloodstream, because it's going through our liver, and liver is our passion, our anger, right? And so we can release all of that. And when we have all of those traumas and we don't have to pay attention to it anymore, we can release it. And then it soothes us, and then it goes through all of our cells, and it takes it into our blood, through all of our body, and it goes through our muscles, and all of our pains and all of those aches and all of those bruises just get melted away. It just gets melted away, and she takes over, and she cradles us. She cradles us like the beautiful feminine mother, gorgeous spirit that she is, and she takes care of us, and we don't have to worry, and we don't have to deal with it, and we don't have to take care of anything, because we can just focus on being with her and letting her take us. And it doesn't matter what happens, and it doesn't matter, we don't have to remember. We can just be in the moment with her, and then we get coded. And if you can feel all of that, and we're going to go down to the base of your spine, and I want you to think about, if you can be willing to think about those chakras, because we're going to go right up through your spine, and then we're going to go out, and we're going to breathe. So if you go to that base of your spine, and this is red, and this is your frustration, and this is your passion, and this is your roots, and this is everything in your red, and I'm just going to go right up your spine, and I'm going to go through the colors of the beautiful rainbow, and I'm going to go a little bit fast, so just kind of go with me, because we're going to be red. And as you're going up, you can go ahead and tighten your body, and then bring it up as you're bringing it up, and breathe it in, just like if you're having that toke, if you're doing that dab, if you're having that hit, like however you want to do it. You can use your hands, and you can use that lighter, and you can think about it, and you can do it. And as you're breathing it in, and we're down at red, and then bring it in and bring it to orange, bring it in and bring it to yellow, and bring it in and bring it up, and then we're up at our chest, and that chakra is green, and bring it in. And the next one up, they don't talk about that much, but this one is teal, because this is love for everybody, because that's who she is, because oh my gosh, I love you, I love you, I love you, and my gosh, I love you, I love you, I love you. And bring it in, and we're at the throat, and then don't let it out, don't let it out, don't let it out. You might choke, but don't, right? And hold it, and hold it, and hold it, and let it go up, and let it go up, and then we're up higher, and we're up higher, and let it go, and let it go, and let it go, and then bring it down like a pendulum, bring it out all the way back down, right? So we're going to do that again. So we're going to start at the root, and we're going to bring it up, and we're going to bring it in, just like you're taking that hit, you're doing that toke, you're doing it, and when you're done, go ahead and pass it, because we can pass right now. Okay, so start it with red, bring it in, tighten it up. So we're going to go red, orange, bring it in more, yellow, keep going, green, teal, at your throat, suck it in, hold it, don't let it out, keep going, up through the head, and then pendulum down. Let it all out and relax. Good. Nice breath. Good. Nice breath. Go ahead and let her fill you. Go ahead and feel that, and just relax into it. Know that she's there. Know that our vibrational frequency changes every time we take part of her. Know that everything is okay, and everything is good. Everything's okay, and everything is good. And go ahead and breathe in with me. Can put one hand on your heart, one hand on your belly, and breathe it in. Nice big breath. One more time, breathe it in. Hand on the heart, hand on the belly. Perfect. One more time. And let it out. All right, whenever you're ready, go ahead and open your eyes. And I know it wasn't exactly the same thing as if we're actually going to be consuming her, but if whenever we're taking part in any kind of a situation, and it doesn't make a difference if people want to say it's recreational, or if people want to say that you know, it's medicinal, because every time we take part utilizing cannabis, it is therapeutic. It is for our benefit. There is a reason that we're taking in her, and that's because, oh, it's starting to get loud. I hope you guys can still hear me. Let me close this door. Excuse me. So yeah, every time that we take part in her, it's because we need to connect with ourselves. We need to get away from all of the distractions that, you know, this world of physicality has taught us, that we're supposed to be like dissolved away from our humanity, our mind, and our spirit, because that is, you know, the non-physical, whereas, you know, our bodies are the physical, but we don't exist separately. We exist together. We exist combined. And you know, the craziness of society and how everything has gone is, obviously, if you can hear the sirens, it's gotten crazy, and there's no denying it. And now is absolutely the perfect time to be able to honor the sacredness in the plants that can take us. Yeah, we've got sirens. If you can hear it, I apologize. But yeah, so this is what our psychedelics are for. And everything, like I said, is therapeutic. So if anybody is sitting around and, you know, people are complaining about people that are doing rec because, you know, I never partook in it when I was younger because of, you know, all of the stigma, but also that one aspect, I didn't feel safe. I didn't feel that the people that were around me were going to be capable of carrying me through my situation, to be able to help me to understand, to be able to have that so important aspect, which is the integration that somebody, I think a few days ago, was saying that integration is education that you remember, which I thought was perfect to be able to say that. And so that's extremely imperative. So not only do we have to understand the intention, and we have to know that, so that way we can feel safe, so that way we can provide consent, which is exactly what we need in any therapeutic situation. It's what we need to do for any situation. It's for every decision that we make, quite honestly. But for anybody that, you know, whenever anybody goes to the doctors and, you know, there's resistance. Well, why do you have resistance? Well, because you don't feel safe. Or, you know, why do you not feel safe? Well, because you don't know what the intention is, you know. Or is it that, like, there's a deeper level of you that knows that this person isn't going to be capable of handling what happens when you get to that level where you're able to release your traumas, and they're not going to be able to handle it. So, you know, we keep ourselves safe from going there by, you know, not consenting. And so, you know, all of those things are important. And like I said, the final piece is that integration. So we have to be able to have somebody that we can talk with, that can help us to be able to integrate that experience of whatever happened and whatever we saw. Because when we're at a higher vibrational frequency, it's like it slows us down. Well, it actually doesn't really slow us down. It kind of makes it look like everything around us slows us down, or is slowed down. So because it's raising our frequency, right? So then we notice things that we'd never really paid attention to before. I had to check the time here. And so, yeah, it alters us. But when we have to come back down, you know, when we have to come back down and deal with this world of physicality and superficiality, right? You know, how are we going to incorporate what just happened? And it's not just cannabis. It's not just, you know, any of the other plant medicines. It's any kind of a sacred experience that we have. It could be going to an amazing event. It could be being with this amazing lover because you connect on this soul level, and then you're not with them, or, you know, any kind of an experience. And it can be a tragic experience as well, of like, oh my gosh, something happened and I don't know how to process it, right? It could be an amazingly good experience. It could be like amazingly like intense, where it's like, you know, bad kind of experience, if you want to label good and bad. But, you know, we need to be able to figure out how to make sense out of what happened, so that way we can turn it into a situation that we can bring with us, so it makes sense. So I think with that, I think I'm good. If there are any questions, or you know, if anybody wants to say anything about their experience or anything like that, I'm definitely open to that.
Man, thank you so much. Really, really appreciate it. You know, I'd love to actually, you know, shift a little bit, but stay mostly on the same topic. Something that I really, that really stuck out to me about your bio, and we haven't had the ability to have a conversation yet, is specifically your work focused on sexuality and the fact that you write for XBIZ. I'd really love to hear, you know, about kind of the intersection of sex and psychedelics, and possibly, you know, some of these meditations that you've, you know, led us through just now, how those can be translated into, I guess, into an environment where we are engaging with sex and psychedelics in that intersection.
Okay, well, quite honestly, to me, it's all the same thing because it's all sacred, right? Because we are, or we have been conditioned to hold judgments against all kinds of things, and that's not reality. You know, that's not actuality. That's not who we all are, and we all exist on a spectrum. And when you incorporate sexuality, like what in the heck is sexuality? I mean, it's honoring you and who you are, right? Like how you identify with the world, how you identify with other people, you know, all of your different qualities, whether they're labeled as masculine and feminine, and just, you know, that whole, I'm going to call it a soup of like who you are. But basically, it's just being allowed to be vulnerable and being letting yourself be witnessed by somebody else being vulnerable while you're witnessing them, allowing you to witness them being vulnerable. And it's honoring the sacred, and it's letting go, it's surrendering. And so with the psychedelics, that's what we're doing, right? We're saying, I'm willing to be vulnerable to myself and consenting to allow the spirit in this plant to hold sacred space for me to connect with me, so that way we can unite, so that way we can exist on a higher vibrational frequency. That's what happens with sex, right? When we're making love and we're holding space for each other, and we're honoring each other, and we're just living in the now and just experiencing all of our senses, and just, you know, eyes opened and like, wow, what's happening right now? And just, you know, really honoring, you know, that with ourselves and with the other person that we're with, which is, you know, what we're doing in guided imagery. We're paying attention, and it's deep, it's soulful. It's like, oh my God, yeah. You know, and then quite honestly, I mean, what do people say when they're high all the time? Oh man, I love you. Like, no, dude, like, I love you. Like, no, you, oh, dude, I love you. Right? It's love.
Yeah.
It's love. It's all love. So yeah.
Yeah. I had a really beautiful conversation with Britta Love a couple weeks back about creating basically spaces that cater specifically to the sex worker community. I worked in the sex worker community for several years, and still practice in some ways. And, you know, one of the things that we stumbled upon was basically this idea of holding space, and how sex workers and healers are so synonymous in the ways that they hold space. I was wondering if you could talk a little bit about that concept, not only for us and our own self-healing through sex, but also holding space for others in that practice.
Okay. So yeah, actually, and it's so horrible that so many of what people think, like so many things that what people think is stigmatized because of the words that people use. And quite honestly, if people would just take a second and listen, you know, really hold that space and honor the other person's reality, and just, you know, sit with yourself and hear them, we would realize that we're all saying the same thing. So if you're a, you know, like a sex worker because you're doing something online, right? Like you're doing videos or things like that. There are people coming to you for a reason, because they need healing, because there's something in themselves that they have to work with, that they have to process, that they have to honor themselves, right? And these sex workers do it, and that's amazing. And they're honoring them without the guilt and without the shame, unless of course, you know, the client wants guilt and shame, but that's a completely different story. But then when you move into like a medical field, which I don't really totally, you know, go on that extreme, where they clinicalize everything, and then there's no sensuality, there's no, you know, connection of self. It's very like cut and dry, and you're supposed to do this, you're supposed to do that, and that I don't think that's the right space either. And I'm more of like the sacredness of it. And so with like sensuality and just like you said, allowing time and space and honoring that person and their experiences, and being there for them to be vulnerable and to be able to recognize that, yeah, like just whatever it is, just, you know, let it out and tell me and experience it, and you're good. And, you know, like just honoring people for who they are and where they are. I don't know. Does that answer your question?
Definitely. And I want to use that to actually bring it back to the meditation that you did, and the conversation you started with about cannabis not necessarily being included in psychedelic culture. You know, at least as of today, what do you think are going to be some of the obstacles facing cannabis being kind of reintegrated into the psychedelic arsenal?
Well, I think that it was marginalized on purpose because anytime we, just like naturopathic medicine was, so anytime you want to bring something back into the norm, it's like you can only do it a little bit at a time, a little bit at a time, a little bit at a time. And so in as much as cannabis was brought back before, we have any kind of legalization for, mushrooms or LSD or, anything else, which everything is paramount and detrimental for mental health, because that is, the autonomy and accepting yourself and all of that. But I think they had to do it like a little bit as a little bit as a little bit. And then there's divides with the hemp and then, with cannabis. So I'm hoping at least that with all of this pandemic and all of these crazy things that are going on, that people are just going to say, hold on a second, wait a minute, wow, explosion. Yeah, this is paramount. Like, this is really what we need. And take away those different stigmas and those divides, because, maybe cannabis might be what works for me. And, quite honestly, I was rear-ended a few times. The third time in less than 2 years that I was rear-ended, I had a severe, major concussion that was horrible. And yeah, I loaded up on the oils every night because it was horrible. And, I call cannabis a major superfood for the nervous system. And so basically it works through the nervous system to affect everything in the body. So that's why it's like a panacea, for me, because all of your sex organs, your immune system, all different kinds of mental disorders that they want to classify them as, everything, can be treated with cannabis. But maybe somebody else, cannabis isn't going to be what works most for them. Maybe like LSD is what they really need, or maybe MDMA is really what they need. We're all individuals. And, what I was saying with naturopathic medicine is, back with the Flaxman report years and years ago, all naturopathic medicine, basically everything except for conventional medicine, was destroyed. And then when they started bringing natural medicine back, they started off as what I call green allopathy. So they could only be a little bit different, and then a little bit different, and then a little bit different. And then the school that I went to was like the 7th school that was brought back. And so, we're more of like fluffy woo woo, and, everything is a spectrum. And I'm kind of like fluffy woo woo flying above the clouds. And so, I think it has to be individualized, and, everything offered, and people just have to be willing to take the risk and to be able to understand like what the possibilities are, which is why informed consent is the most important thing, obviously followed by integration. So, I mean, as long as people feel safe, they're willing to go anywhere with you because you're actually trustworthy. So that's what it all boils down to, which is, that's the sacred part of it to me.
Definitely. Well, why do you feel that, this process of psychedelic assisted therapy hasn't really, been seen as much in the cannabis space up to today, where we do see certain practitioners who've been working maybe for, the last 6 years, decade on this, but it's not something that was really, I guess, talked about. Would love to hear your perspective.
Honestly, because going through medical school, like I went through a naturopathic medical school, right? So like I'm actually a doctor, I practice on cadavers and all of that kind of stuff. Like, I'm a medical doctor just with natural philosophies. But in pharmacology, the only thing that they teach is how it's a Schedule I drug. And of course, all these things are bad. And even looking in, research for all of the different schools, most medical schools don't even talk about cannabis at all whatsoever. And if they do, all it is saying that it's this horrible drug that I don't know if you're supposed to be able to die from it or what, but all of this misinformation and like the big just say no movements and all of the anti-drug and whatever. So fears, politics, and I mean, quite honestly, what's the best way to keep somebody from growing? Make them afraid of the things that are actually what uplift them and help them. So if everybody just partook in plant medicines when they needed them, they honored and trusted it, and then held space, actually listened to each other and loved unconditionally, like, I mean, you wouldn't be really needing people to tell you how to live and what to do because we would all know better, right? So it's a bigger problem.
Definitely. Well,
Yeah.
Lee-Anne, thank you so much for joining us. Thank you for your meditation. Thank you for your wisdom and your insights. We really, really appreciate your time.
Thank you so much for having me on today.
Yeah, be well.
Thanks. Bye.